Hello, I'm Michael Ciamarra, and here's what's happening inside Montgomery. This past week, the legislature focused on two really big items. First, what the new Federal Health Care Act will require of the states in new taxes, new bureaucracies, and new mandates. And second, the education budget. With only 8 legislative days left in the session, passing next year's budgets will now be top priority. The House Education Appropriations Committee reported out a bare-bones budget for K through 12 and higher education. The committee approved a nearly $5.5 billion education budget that would be 3% more than this year, including the current proration. The chairman of the committee, Representative Richard Lindsey, explains the challenges he had to face in crafting a budget.
Teachers are taking duct tape and they're fixing the books. We're doing with using older computers and doing without computers for those that may have quit working properly. When you're having to live with cuts, nobody likes it, but in this case they understand it. When you lose over 20% of your budget over a 2-year period, it makes it difficult to make ends meet. So what we've done in this budget is try to save as many teacher jobs as possible, not because they're jobs particularly, but because it's absolutely essential. I've heard from administrators all over the state, and what they tell me is we can't afford to lose any more teacher slots. If we do, we're not going to be able to provide the basic classes. So that was our number one goal in this budget. As far as the classroom materials, books, technology, they're not funded again this year, and that's a serious problem.
Figuring out the new National Health Care Plan is another critical statewide concern. The Obama plan could cost Alabama $60 to $100 million more every year. It also expanded Medicaid eligibility, pushing state enrollment from 900,000 up to a possible 1.3 million Medicaid recipients. Senator Scott Beason forced 2 votes last week on Senate Bill 233, which would prevent the federal government from forcing Alabama to participate.
Some of the reforms, whether you agree with them or disagree with them, it doesn't affect. All it simply says is that no one in the state, not an employer, not an individual, nor a doctor, can be compelled or forced to take part in any health care program. They can't come in and be forced into a government program. They can't be forced into a private program. It's all about rights and liberty and being able to decide what the future is for you and your family. That's what it's about. It's very simple, very short. I think we're going to have to defend ourselves against where the federal government's going on a number of fronts. But this is a simple, easy, one-page thing. It's just a start in the battle.
So far, 39 states have introduced similar bills to stem the tide against the unconstitutional nature of the National Health Care Plan. Thank you for watching, and please keep sending us your questions on bills that you are interested in.